Brought to you by GTA, your island, your network.
The directive from the administration and Legislative Health Oversight Chair was clear. In a letter to GMH CEO Peter John Camacho, Governor Calvo says it's imperative for the legislature's understanding of, quote, all aspects of hospital management and financial challenges. He adds the current situation is an opportunity to give much-needed funding to Guam's public hospital. Camacho was unsure if he could comply.
On the bottom of the report, there is a little particular section there that says the report is disclosable 90 days after the date of survey. We don't know if there's any sanctions if you breach that.
As we reported, the Guam Memorial Hospital will be kicked out of the Medicare program on October 3rd if its corrective action plan is not deemed acceptable. The CMS survey report documents 80 pages of deficiencies that, quote, adversely affect patient health and safety. The survey was a result of an April visit to GMH by CMS. According to the survey, the 7 areas of Medicare program requirements GMH has not demonstrated full compliance in include an ineffective governing body, nursing plan, radiological services, discharge planning, and violations dealing with the safety and conditions of facilities at the hospital, among others.
Do you believe that it is a finance or a management problem?
It's a combination, as we've said to the senators. There are direct and indirect causes for some of the findings.
Calvo's letter to Camacho follows a letter from gubernatorial candidate Leon Guerrero earlier today to the governor calling on him to order the hospital administrator release the CMS report and corrective action plan. You might recall Camacho admitted that he did not give copies of the CMS report to the hospital board. This became a management concern from lawmakers who say they can't help without any knowledge of the findings. Committee Chair on Health Senator Dennis Rodriguez Jr. also issued a legislative subpoena to Camacho, commanding him to produce the 2 documents which he said were critical to the financial survival of GMH. It was sent to Camacho on Wednesday, giving him until June 27th to produce the documents, or else he would be held in legislative contempt and face up to a $1,000 fine or a year in prison.
The constant pressure from island leaders forced the CEO to act, even after the uncertainty as to whether or not he could release this critical information. So you will provide that information to the senators?
With regard to the
report and the hospital's response?
Yes. Okay. Yes. We're wanting to work with the senators, so we'll do what we need to do.
Camacho says different departments are already working on their corrective action plan, and he has sent a copy to CMS. Reporting for Guam News Network, I'm Carmen Victoria Turlahi.
Brought to you by GTA, your island, your network.